The reason we have this new health care bill that got passed, agree or disagree, it's a good idea, is we're trying to get the uninsured covered. Is that correct?
That's correct.
Okay. I have an idea. I want to see what you think of the idea. Since you go to medical school, and we just figured out some other sources, it could cost you $400,000 just to go through undergrad in medical school, and really don't have a good way of paying back. I have an idea. Tell me if this is a good idea. When you're in private practice, see the uninsured patient for free, no income to you, and get between a $60 to $100 reduction in your loan. So maybe you could work 1 or 2 days a month and pay it back with work. So it's a win for the uninsured, and it's a win for someone to go to medical school, giving a way to pay it off without the pressure of these loans and huge interest. So this might be a way of helping everybody. And maybe that top student in the class today who doesn't want to be a doctor, right, might rethink, because you want the best minds to become a doctor, not just someone who can afford it. Is that correct?
It is. I think that's an interesting approach.
So if we did something like that, then the uninsured is not a liability. It's an asset to society today. And some people can't even afford the insurance in the past. Maybe they could be pushing this a little bit. And maybe there'd be some other incentives to doctors to work in certain areas or go into certain utilized areas that we need more, say, pediatricians, internists, subspecialty in pediatrics. They're a very limited number of people going into today. And maybe it's a way of enticing them in a nice way where you could do a little bit for yourself and a lot of good for the community. And besides, when you become a doctor, the thing you're becoming a doctor for is to probably do the right thing in your community. Is that correct?
That's correct.